Hi, I'm Dr. Cynthia Seebacher, and I'm going to show you the correct way to breathe and activate your core. So the first thing that I want to talk about is when you first sit down, we need a nice wide base to support ourselves. So as you sit cross-legged, I want you to actually lift your butt cheeks and bring them out to the side so you have a nice wide base of support. Now, as you do that, I want you to just kind of gently roll back onto your back pockets as if you're wearing your favorite pair of jeans. Roll back so that your back pockets are touching the floor behind you, just the bottom tip of your jean pockets. Now you'll notice that your belly is able to hollow out. Lift up through your spine. You always want to think about lifting your heart center up to God or whatever it is that you believe in, your higher power. I'm just going to use God, Spirit, Universe. Lift your heart center up so that you're opening your heart. Your shoulders are going to roll back and down. Bring your hands gently on your knees with your palms open to the sky. This brings you into a position of reception. You're ready and willing to receive whatever it is the universe has to offer. So now you'll notice that you're actually sitting pretty straight. And you don't have to worry so much about your head and your neck because the rest of your body is in perfect alignment. Now we're going to go ahead and bring ourselves to a lying down position. Placing your hands on your belly, walk your shoulder blades underneath you, folding your shoulder blades underneath your body. I want you to go ahead and tuck your chin just slightly. Press your low back into the floor. So you're going to shift your hips so that your low back is touching the floor and then relax from there. Placing your hands on your belly. As you take a deep breath in, I want you to fill your belly. It's a balloon. The diaphragm lives underneath the rib cage, and when it expands like a balloon, that's what's pulling the oxygen into your body, into your lungs. So your belly expands with air. I like to call it a Buddha belly, So a nice big round Buddha belly. And then exhale from there too. Notice I'm not breathing up here in the upper chest, because that's what gets us into a lot of pain syndromes. Our neck starts to bother us, our shoulders get really, really tight. This is all about breathing down to your belly button. So deep breath in, nice big Buddha belly. Exhale. Inhale, big Buddha belly. Exhale. Now, if you've taken one of my classes before or we've done a one-on-one training, you'll remember that we play a game called Smash My Fingers, where my fingers are underneath your head, so that when you take a nice deep breath in, I ask you to tuck your chin and smash my fingers. I don't care how many double chins you have, that's the name of the game, is create those double chins. So, as you take a deep breath in, you're going to nod your chin down and you're going to smash your finger. Well, my fingers. So, deep breath in, tuck your chin. Exhale, you get to release it all. Deep breath in, tuck your chin. Exhale, release it all. Now, the third part of this breathing is going to be to press your low back into the ground. So, it's a very small movement. So, if I'm up here like this and you can see the tunnel with my back, I want to smash that tunnel down. So I'm going to just press my low back into the floor. So it's a deep breath in, tuck your chin, flatten your back. Exhale, release it all. Deep breath in, tuck your chin, smash the low back to the floor. Exhale, release. Now if this gets to be just way too much, focus on one thing. Whether it's expanding your belly or tucking your chin or flattening your back. So I'm going to keep this sexy posture here for just a moment. So I'm pressing my low back into the floor. You can see how my abdomen is starting to engage. It's not lifting up like this. It's pressing your low back down. It's not lifting your hips up like that. It's pressing. So as you exhale, you press. Inhale, expand. Exhale, press. Or think of it as a squeeze. So it's that squeeze that you're looking for. You're going to feel your muscles engage. So we have this transverse abdominis muscle, and that's the corset muscle. So all of that squeezes together. Then you have your rectus abdominis, which is your 6-pack or 12-pack abs. That is going to bring your ribs and your shoulders towards your hips and your knees. Flexion is what the rectus abdominis does. Transverse abdominis squeezes everything in. So inhale, expand. Exhale, contract. Squeeze at the very end, pressing your low back into the floor, and you will feel everything engage. If you really focus down on your the lower part of your abdomen, that's going to be a nice little squeeze. Inhale, relax everything in your belly. Exhale, press your low back down to the floor, squeeze. Now these are all the things that you need to know before you even go into a yoga class or a Pilates class. So let me just take you one step further for the Pilates 100. So we're going to take a deep breath in, tuck your chin. As you exhale, you're going to press your low back into the floor and then activate that rectus abdominis to whatever level you feel comfortable. Your shoulders are relaxed and down, your chin is tucked slightly, and you're looking kind of at a 45-degree angle at the ceiling. Now, this is the 100, so it's 10 in-breaths, 10 out-breaths for a count of 5. So you're going to inhale 2, 3, 4, 5, exhale 2, 3, 4, 5. And you keep going until you've done a series of 10. And then you get to relax. Roll your shoulders underneath you, place your palms open to the ceiling, press your low back down into the floor. Now if you want to practice this as a curl up, deep breath in, tuck your chin. Exhale, press your low back into the floor. Exhale, curl up. Inhale, hold. Exhale, release. Deep breath in, tuck your chin. Exhale, curl. Inhale, hold. Exhale, release. Always make sure you roll your shoulders back underneath you, palms open to the ceiling. If you feel that you're ready, you can extend your legs long. And if this was a yoga class, this is what we would call Shavasana or Savasana. It's called the corpse pose. So you fold those shoulder blades underneath you, tuck your chin just slightly, palms are open to the ceiling, engage your core. Good. And then allow yourself to relax. And this is how we incorporate the breathing technique for yoga and Pilates. So just to kind of reiterate, when you're pressing your low back into the floor, you're activating all those little tiny muscles that go from vertebrae to vertebrae. They're called multifidi. Very tiny. But if you don't activate those, then all this just becomes a big bulging belly. You've got to squeeze your abdomen and press the low back into the floor to activate the multifidi, the transverse abdominis, and the rectus abdominis. If you're having a lot of back pain, before you change positions, squeeze your knees first. So when you squeeze your knees, press your low back into the floor, squeeze your belly, then you can roll over onto your side, squeeze your knees, activate your core, press yourself up to a seated position. And remember, I said that we always want a nice wide base of support, so walk your butt cheeks out to the side, roll back as if you were still pressing your low back into the floor. Think of tucking your tailbone just enough so that the very bottom tips of your pockets rolling back to touch your pockets onto the floor. Lift up through your spine, raise your heart center, roll your shoulders back and down. Let your hands rest gently on your knees with your palms open to the ceiling. Gently tuck your chin and take a few breaths from here. So still, there's that nice big Buddha belly on the inhale. Gently exhale. Notice what I'm not doing is, when you breathe up here in your upper chest, that's what causes a lot of neck pain. These muscles here, the scalenes, they raise the first rib when you breathe. We call that inspiration. If you're breathing all up here in your chest, that would be the equivalent of taking a 1 pound weight and doing a bicep curl all day long. It's not a lot of weight, but it's a lot of repetition, and that's going to fatigue the muscle. And when a muscle gets fatigued, it kind of freaks out and goes, oh my God, we can't move anymore. And it gets tense and it contracts. Well, that's what happens with your scalene muscles. They get tight and tense and they contract. And then your neck starts to hurt. And it's always the weaker side that hurts. So if the front of your neck is all contracted, the back of your neck is what's going to start to hurt. So breathe down into your belly. Let your belly expand with air on the inhale. Gently contract as the exhale. That diaphragm muscle has to contract to push the air up and out of our lungs. It expands, brings the breath in and down, and then it contracts and presses the air out. And that is how we breathe. I'm Dr. Cynthia Seebacher with fusion-chiro.com.